So let's say we developed some shoulder pain or we injured our shoulder, whether it was lifting, outside lifting, whatever. We've got a shoulder issue that's affecting the lifting. So let's say we have found out that the low bar position, the rack position is not tolerable with that. We've also found out that a full range of motion bench press, especially at normal weights, is not tolerable. And we found out that the overhead press is not tolerable. And that pull-ups are not tolerable. So using our base template we just talked about, here's some modifications we can do. So for squatting, if the low bar squatting is not tolerable, then we can do a high bar squat, a safety bar squat, or a front squat that has different rack positions that are less stressful on the shoulder where it's tolerable. We can just switch that out and still do the same 3 sets of 6. We just adjust the weights to meet that same intensity that we have programmed, like RPE of 6 or 70-ish%, 75%, somewhere around there. So all we have to do there is just switch the squat variation just to pull some stress off the shoulder, but we can still get the squat stress on our legs that way. So for the bench press, so if we can't tolerate the full range of motion bench press and at the same sets and reps, but we found we can tolerate about half to 3/4 of that range of motion, we can do one of two things. We can take the safety pins in the rack and set them right where it stops us, right where the pain is or right above it, so we're not poking into where it's really painful. And we just stay with our same 4 sets of 6 and adjust the weight to that same intensity of whatever's prescribed. And then we just do pin presses there. So we're still bench pressing, we're still handling the weight, we're just taking out the part of the range of motion that hurts. And the way we would progress this over time is we could either, at some point we want to work back to a full range of motion bench press, but we could keep the pins the same and try to increase the weight just like as we would normally. Or we can keep the weight the same and then see if we can, like if you have the 1-inch pins or something like that, see if we can lower those down over time. You can also use like a board press or like a towel under your shirt. Just anything that gives you a little block that stops you right outside of where the pain hits. So modify the squat position on day 1. We modify the range of motion on the bench. Day 1, RDLs were fine, so nothing needs to change with that. Okay, for day 2, deadlift was fine, didn't affect the shoulder, so we don't change anything there. For the overhead press, we found that wasn't tolerable, but we found out we can do some dumbbells because we can just kind of move our shoulder in a different groove, plus the dumbbells are just inherently lighter, so our shoulder just tolerates that better. So since they're lighter, instead of doing the heavier 4 sets of 6, let's go ahead and increase some volume, and let's do like 3 to 4 sets of 10 with that. So we're still overhead pressing, and we can still push them. We're just modifying the stress a little bit, but still getting the overhead press work in. So, and then for high bar squat, let's say that high bar squat's just sensitive enough that we can't really do it here. Maybe we could do it here and here, but we can't do it 3 days a week kind of thing. So we modify that to, let's just do something where we're not even loading the shoulder at all, but we're still loading our legs and getting the squat stress in. So we can do something like a sissy squat, because those can be, you can hold onto a rack and really dive your knees forward, so you're not even loading your shoulder or arms at all, really. Or you can do like split squats or lunges. Those can be plenty stressful enough and give you good squat stress. And if you need to load it, you can hold dumbbells, which usually is probably not going to irritate your shoulder. I mean, every pain situation's different, but a lot of times that's usually not going to be as irritating as having a barbell in the rack position. So for day 2 modifications, no change to the deadlift. We go to dumbbell overhead press instead of barbell. And then for the high bar squat, we're switching out something that's not even loading the shoulder at all with like sissy squats, split squats, or lunges where we can use just body weight or dumbbells. So for day 3, with the squat and the bench, we'll repeat it again except for what we're going to do. So we still do the high bar squat, the front squat, and safety squat just like we did up here. We could do the same variation, or we could do another one too, depending on how the shoulder is, or if you just want to do a different variation, that's fine. Same 3 sets of 6 programming with that. Then for the bench press here, so we're going to try to do full range of motion. So let's say we found out, we can do about 50 to 60% full range of motion, and that's tolerable. Well, what we can also do is slow that down and take about 50 to 60% of what our work sets weights were, do about 3 seconds to go down nice and slow, and then 3 seconds to go up. Sometimes that slow tempo gives you a time to feel out where positioning is, so if something kind of hurts, maybe you can move your arm a little bit. Sometimes just that slower tempo is less stressful and it's more tolerable too. So it can also make you feel like these can be pretty tough, and it can make a lightweight feel pretty challenging. So it can still make you feel like you're training hard, and it's allowing us to creep into that painful position without as much pain. So really what we're doing with the bench press, it's affected the most in this particular situation, as we're trying to keep the weight the same. We're just modifying the range of motion, and then we're going lighter but working through trying to desensitize the full range of motion. So then if pull-ups were not tolerable, just say your body weight pull-ups or however you're doing them, too intense, shoulder didn't like it. Lat pull downs is probably the most obvious substitution. It's pretty much the same movement pattern, but you can modify the weight and the stress on it. Sometimes too, if you do like a chin up grip, like a supinated in close, sometimes that loads your shoulder different. That can be more tolerable. So instead of going from your regular pull up, you could go to a supinated like chin up pull up or chin up grip for the pull downs too. Or you might even be able to just switch from pull ups to chin ups, and just that grip change might be enough to make it tolerable. So just there, we have our base template strength training program. Those are just right there could be modifications we can do that can actually help address a shoulder issue and also keep us training and not derail our training. So, and then the main thing outside of just modifying to tolerance is then we have ways to progress it, right? Because here, the modified range of motion, we can increase that range of motion over time. And then here is allowing us to work through and desensitize that range of motion too. So, and there's not a specific length. This would just be whatever your shoulder's telling you. It could be a couple weeks of doing this. It might be a couple months of doing this. But we're still training, so there's not like an infinite deadline or a specific deadline on that. We just want to train and progress things when we can, and then at some point we're just going to be back to normal training again. So one other option that I think that can be valuable, and you don't have to add in all these corrective exercises and all that stuff. Sometimes you have to be careful doing that anyways, because if you're already training pretty hard, your shoulder starts hurting, or you have an injury or whatever, whether it's from the training or not, if you add in a bunch of extra exercises, you've just increased a bunch of stress on your shoulder, so that may actually make it worse. So, but sometimes it could be too that maybe your shoulder does not get enough direct work, so it doesn't have it. The tolerance is actually, the capacity is not actually where it needs to be to handle all of this. So maybe we should add in a little bit of what I say capacity builders. So if it's tolerable and that kind of thing, and if you feel like, if we determine that's kind of where we're at, is like, the bench and the press are all great and plenty for the shoulder, but sometimes you might need a little more work just to help that too. Things that could be built in are doing like lateral raises, front raises, reverse flies, those kind of things. I think those are good exercises that you could add in. Not necessary, but I think they can be good. So pretty much we want to stick with our same template, make modifications to accommodate the shoulder that can be progressed over time, and then potentially, optionally, situationally, depending on what it calls for and what you feel like you need to do, that kind of thing. Then we can add in some local capacity builders if we needed to. And things like these, I kind of like to treat them almost like bodybuilding. I treat them like bodybuilding exercises, but kind of the same for rehab too, where I like just saying, we're going to do like a set number of reps, like 30 to 50, somewhere around there, and we'll just try to do is push each set as close to failure as we can, provided it's within tolerance. If you can't push that hard because of pain, then we just go until the pain starts to get kind of on the edge of not tolerable, and then we stop our sets. And you just do set after set until you add up the 30 or 50 reps, and then over time, ideally, that's kind of our progressive loading, where it takes less sets and you're doing more reps in a set to get there. So, but here is a way we can use that strength training template just to help address the shoulder issue. And doesn't take any specific corrective exercises. We don't have to get away from training. We don't have to detrain. We can just keep training.